Hello, my name is David Luna, and today I'm going to be talking about the Patient Protection and Affordable Care Act. We do have to go back to 2008 and 2010. President Obama was just elected. Our real estate market just crashed. We're in an economic recession, and the uninsured population in America is rising. In 2008, we had an uninsured population of 44.2 million, and in 2010, it was 46.5 million. So 17.8% of our population up to that point didn't have health insurance. So the Obama administration's response to this was the Affordable Care Act. It was touted as a irrefutable victory for racial justice, right? It created an online marketplace that did exactly what the name says it does. It provided protections for patients against discrimination by insurance companies for any pre-existing conditions or discrimination against their children for developing conditions or pre-existing conditions from being kicked off of their health insurance. There's individual mandates, I'm sure everybody remembers. So you can go right on this website, healthcare.gov. The only thing you need to qualify is you got to be a United States citizen. You can't be incarcerated, or you can be legally present. So if you have a residency card, I do believe that you qualify. That's pretty big, especially among the Hispanic community. And Medicaid Expansion isn't the only form of subsidies that you might qualify for. There's premium subsidies for people that make between 100 and 400% above the federal poverty line as well. So make sure to go on there, check it out. I love this picture. It shows that difference between equality and equity, and just showing how some people need a little bit of a boost to kind of have the same field of vision that we do, or to benefit from the same field of vision. So that's kind of how I look at it, because as this map shows, 28% of our population, is able to benefit from the Affordable Care Act expansion of Medicaid, because they fit within this range of income level that's 138% above the federal poverty line. I didn't realize that 51% of all births in America are covered through Medicaid. That's something I wasn't aware of. It's very important for women's reproductive health and prenatal needs that they might have. It's even used for covering unplanned births, for lower income women that might not have been planned for beforehand. So, and providing the funds to be able to pay for those medical costs. I even found a study by the Public Library of Science from this year, 2022, that since Medicaid has been expanded, for the states that did expand it, because not all states expanded, something we're going to talk about in a bit, there was a decrease of arrests being made, a 20 to 32% negative difference in overall arrests. Some of the key highlights that I've been finding was that there was historic reductions in racial disparities in regards to healthcare access from 2013 all the way up until the Trump administration. As soon as he stepped in there and started changing things up, reducing how much money was being provided, and then I was seeing that 46% of black people live in our country that live in 15 non-expansion states. So that's kind of huge. I don't know why there's that correlation, but so not all states are providing Medicaid expansion. So that's a huge topic of debate between the majority of our country and Texas to Florida, North Carolina, Georgia. Some more important graphs that I've found that how the Affordable Care Act has helped Black and Hispanics, and black adults living in expansion states now have a higher probability of having health insurance than white people in non-expansion states. So that's a pretty cool graph. Hispanic adults in both groups of states reported lower uninsured rates and reduced disparities. The gains were larger in Medicaid expansion states. So that's kind of cool. I mean, it initially sounded kind of good. I think it's a little bit misleading, but that's why I kind of wanted to show it, because it sounds like, wow, Hispanics are really covered. Like they're making all this progress and stuff. They must be doing pretty good. But here we see this other graph, and that's obviously not the case. And it kind of shows what I was talking about in 2016. Once we were making this, probably looks like we had been coming down from 32%. If you look at it specifically Latino, that's what I'm looking at, right? Because I'm Latino, I'm Hispanic. And 2010, when the Affordable Care Act was first passed, there was an uninsured rate of 32%, and that went all the way down until you got to 2016, and it kind of just been, it's stalled out 19%. 19%, and now it's starting to come up. Is what I was talking about, is that it reversed the progress, because now we're starting to see the uninsured rate rise again, and that's unfortunate. So high medical expenses, right, and health insurance prevents financial hardship. According to a study by the Journal of General Internal Medicine in 2019, approximately 137.1 million adults report having a medical financial hardship in the U.S. So that's 51% of our population. That just shows the importance of the providing affordable health care. If 51% of Americans are suffering through some sort of financial hardship, of being unable to pay for this medical bill or expense, Affordable Care Act, noble intention, started to work. Trump came in, changed it all up. And the data is skewed the other way now. It's like it's showing that uninsured rates are beginning to rise again, and things haven't been working the way that they were intended to work, and they were announced to work. Like that Nation article from the beginning of my presentation, that it said that the Affordable Care Act eliminated all racial disparities between black and white people in regards to healthcare coverage. I think that's not right. So young adults are benefiting from being able to stay on their parents' health insurance. That's another thing that I found about the Affordable Care Act. That was across all racial and ethnic backgrounds. All young adults up to the age of 26 were able to seek preventative health care and just to benefit from being able to stay on their parents' health insurance. Since 2017, coverage gains stalled and began reversing, and reflecting a range of actions by the Trump administration, including decreased funding for outreach and enrollment assistance, approval of state waivers to add new eligibility restrictions for medical coverage, and immigration policy changes that increase fears among immigrant families about participating in Medicare and CHIP. And that's very true. Like, people already are distrustful of the government, right? So this is what my information is found. The Affordable Care Act, noble, has it worked? I don't think so. Majority of people I know, I'm Latino, are uninsured. I'm uninsured. It's a huge expense. I think I'm healthy still, right? And that was the problem with the individual mandate. It kind of made it feel as though the young people were shouldering that burden of the older generations that do consistently need healthcare coverage or attention, right? And maybe I'm running a risk not having it, but at the same time, going through the portal of the Affordable Care Act, it just didn't work out for me. Because of the way the income's reported, there's no way for me to report my crypto gains, so I called, and they're like, well, you have to get a denial letter from the Medicaid in order for you to qualify for these subsidies. So I went to Medicaid, and they're like, well, you put 0 for income? I'm like, yeah, because there's just no, I didn't realize. I'm trying to put my income. That's why I'm calling you guys. I'm trying to figure out how to get coverage, but there was just no way for me to report my income. I mean, not the way I try, because the way I make income is completely different from what the Affordable Care Act's little boxes were allowed me to put in. So, it just didn't work out for me. I wasn't able to get a Medicaid letter that denied it because they wanted bank statements of all my crypto transactions. It's just too much of a hassle. I don't have time for that, right? I got to do my homework, write these presentations, and attend to my other needs. So it's not an excuse. I just think that it just didn't work out for me. If it didn't work out for me, I'm pretty diligent, hardworking. I'm on my computer all day, every day. And if I felt that it was too much of a problem, of a hassle, I can't imagine for other people, right? So this is Dave Luna. Thank you so much for listening. I hope you guys have a great day.